It acts by inhibiting ovulation and maintaining the mid-follicular phase levels of estrogen. Now, this was the paper which really changed the outlook on using UV Pristal. So, the Swiss Army knife of hormonal treatment. When we're talking about the medical management, currently we have two drugs which are there in the Swiss, which we treat as the Swiss knife. One is the uripristal acetate, which we already had available in India, and the other one are the oral antagonists, which we look at, which are available in Europe, but I think they should come in a few things. So when we look at uripristal acetate, what we're looking at is its selective progesterone receptor modulation. So it has a partial antagonist mechanism and a partial agonist mechanism as well. So this Pearl 1 and Pearl 2 studies was the ones that actually brought this into the picture. So your Pearl 1 study basically helps us decide what dose was actually helpful to make a decision on what dose to be given to a patient, while the Pearl 2 study actually gave us an outlook on how it compares to the GnRH agonist. So when you see in the study, the uripristal acetate had a much better response in anemia correction. So what it was doing was it was stopping the bleeding, and when you were giving the iron as iron tablets along with it, the anemia correction was much better with the uripristal acetate group. When we looked at the fibroid volume reduction also, you can see that even with the follow-up, the larger fibroids had a much better volume reduction on uripristal acetate. Again, when you looked at the safety profile of uripristal acetate as compared to GnRH agonist, you can see that the side effects with uripristal acetate are much lesser. The incidence of hot flushes is lesser. The requirement for ADVAC therapy is also not there with uripristal acetate. Now the Pearl 3 study, which was basically the extension, saw that 80% of the patients when given uripristal acetate for 4 courses of 3 months each, it was basically seen that they had no bleeding or spotting, and there was a massive reduction in the volume of the fibroids. That was more than 25%. Only 1% of those cases still had some bleeding and the volume didn't reduce. So you can go on to see that uripristal acetate actually did have a very good functionality. I know a lot of y'all must be thinking about that it was stopped from 2012 to 2019 because of its liver injuries. But I'm getting to that. You will see that why it has been brought back into the system. This was the Venus trial which was there in the US. Over here if you see, it says only about 55 to 60% of the patients had success with uripristal acetate. But you have to understand that when we are looking at it, the ethnicity of the people which were included in this study were African American people who had a much more incidence of developing fibroids, and ethnicity may also have had an effect on deciding what could be the effect of the uripristal. Now when we look at infertility management, Jack Donez actually had done the study, and he's given the algorithm which talked about type 2 to type 5 myomas. As you can see in the algorithm, if you have a good response with the uripristal acetate where the volume reduction is there after about 2 courses of 3 months each, you can actually even think about natural conception for these patients. Or if not, we always have the option of what my mother, Dr. Anita, always says, do the sandwich therapy. Get the oocytes, freeze them, then give the uripristal acetate or do your myomectomy and then do the transfer. So even that is an option where you freeze your embryos, then start your course of uripristal acetate. If the volume reduction is there, it's no longer distorting your endometrial cavity, then you can even think of even doing the embryo transfer in those situations as well. Of course, remember, if the uripristal acetate doesn't work, surgery is the mainstay for these patients, and that's eventually going to be the final thing. But this is actually reducing the morbidity in these women and reducing the complication rates as well. So what alternatives do we have? Now when uripristal acetate was stopped between 2012 and 2019, almost 20% women who were initially taking uripristal acetate had to undergo surgery instead of the medical management, and they were clinically stable patients who may not have required surgery if the medical management would have continued. Now when we look at the complication rates, or rather comparing them to the surgical interventions, this is where I was talking about your drug-induced liver injury. it's all, if you look at all the studies, it's 1.5 out of 1 lakh patients which have a risk for drug-induced liver injury. Compare that to your uterine artery embolization. 1 in 50 have a chance of major hemorrhage, 14% chance of infection. Look at your myomectomy and hysterectomy. Your myomectomy, 1 in 20 chance for hemorrhage, 1 in 25% chance for other anesthetic complications. Your hysterectomy, complications of 1 in 100 for hemorrhage, vesicoperitoneal fistulas, urethral injuries, and rectal perforations. So if you go on to see, the safety profile when you think about medical management is not there. Yes, even I am scared of using this initially, but now we know that we can do a liver function test. It is easy to monitor the effect of Uterine, and and if you go to see, the mortality rate of the drug-induced liver injury is 0.1 among 1 lakh. So you can see that the number of patients which are actually affected by Uterine on the liver is very low. If you can, this was again a paper published in 2021 July, which said that the risk of death from laparoscopic hysterectomy for fibroids is in 12 out of 1 lakh. For abdominal is 32, but compared with the risk of just drug-induced liver injury is 10 out of 1 lakh. So you can see that the safety profile is definitely much better than the surgical. This was this drug-induced liver injury. This was a fantastic article. How many of us actually just pop diclofenac randomly on a daily basis for headache? Can I just have a show of hands, please, if you all don't mind? I'm sure some of you are feeling shy. I think all of us pop a diclofenac at any point. If you see, that's a category A drug for liver injury. And if you go to see uripristal acetate, it's a category C drug. So in that terms, that the drugs which we are already using do have already a risk. You talked about paracetamol. That's another drug which is popped in like this, like candy. I think you eat less candy than possibly paracetamol at times. So in those situations, you have to understand that it's important to see the pros versus cons and use uripristal in a more better manner, so that we can understand that surgery can be avoided in these patients. So Bronson had said that there were 12 cases which were reported with drug liver injury. He said that if there are less than 12 cases described which have been reported, that means, is it actually showing a hepatotoxic relation, or could it have been some other underlying cause which could have caused this liver injury? Amoxicillin and aspirin are also known as hepatotoxic. I have cut out one slide which actually gave a list of all the drugs which we commonly use which can cause liver injuries. So now the other medication that can be used in the medical management is the oral GnRH antagonist. Now the oral GnRH antagonists unfortunately are not available in India as of yet. But elagolix, linzagolix and relugolix is something that is there in the European market, so which is being used for the medical management as well. So if you see, all three do require a little bit of add-back therapy, and a paper which was just published in May 2022, it was a meta-analysis and a review of 5 studies including almost 2,500 women. They said that using 300 mg with add-back therapy or 40 mg relugolix with add-back therapy, it was just about these 2 drugs, said that had very good volume reduction, also improved the reduced the fibroid volume. It also showed that it reduced the fibroid volume, and it was also useful in patients who could not undergo surgery at that point of time. So it did help them manage that part till menopause, especially in the perimenopausal age group. Another thing they said, that elagolix used at 600 mg, that's BD, had a much pronounced side effects such as your hot flushes and postmenopausal symptoms. So you do need to give estrogen and progesterone add-back therapy with these drugs. We're running a little bit out of time, so I'm going to just rush through my last 2 slides, so that's great. So this is what Donis actually proposed when he was just thinking about the oral antagonist. Especially in infertility, if it's a type 0, 1 or 2, that means it's in the cavity itself, just go ahead and do a hysteroscopic myomectomy. A type 2 intramural, as I said, do your controlled ovarian stimulation, vitrify your embryos, put them on oral antagonist or uripristal acetate for a period of 3 months. Then you can decide a natural conception or an immediate embryo transfer if the volume reduces. If it doesn't, then you go in for a surgery. So, because I was going to be talking about the medical management, we can see that these are the different drugs. But we have to understand now that we are in India, we have only the agonist and we have the uripristal acetate. These two are very good, and now with uripristal acetate we can see with the studies it is giving us much better responses and its safety profile. Please understand that when you are using uripristal acetate, it's advised to do your LFTs every 3 months. I err on the side of caution. I would suggest to do it every 40 to 45 days just to be on the safer side for yourself. So thank you so much for a patient hearing, and I hope I was able to. And just a request, I'm going for the chairperson of Young Talent Promotion. So requesting Lucknow OBGY Society to please support me. Thank you. And the entire state of UP as well, please.
Thank you so much, Dr. Rohit, for highlighting use of uripristal in medical treatment instead of rushing for surgery. Thank you so much. And now we will not be scared about liver, because other drugs are also causing liver problems if we do liver function. So I think you have made it very clear. Thank you so much.
Thank you so much.
I would request the experts of expert, Dr. Nandita Madam, to please give the final opinion and tips for us regarding the